Just in case there's anyone out there in the audience, do people out there have any comments about what they think are practical areas that could be areas of focus that we either haven't heard a lot about or only heard a little bit about?
Well, and I'm just going to jump in really quick and say, to make it easy for everybody to chat and to have this discussion and to not feel like you need to formally stand, I'm happy, at least for this side of the auditorium, to try and run around and bring the microphone to you all. So,
I'd just like to add to what was just said about the people that have needs for this. It's more important, from my perspective, for communication and education of everyone. I work with clients all the time from all income levels, social levels, and the bad effects of the microbiome, the bad effects of sick buildings and the conditions in buildings is an equal opportunity fiasco, basically. And when I work with people that have PhDs, very articulate business people, they don't know any more about the indoor environment or the microbiome or microorganisms than anybody else. So the vast majority of my time working one-on-one is educating them on these issues so that they can understand and comprehend what's going on. So if we want to move all the excellent information that we've gotten here at this conference and beyond, we really need, like Ed Young was, we need more of him to get out there to really present this to the general public so that it becomes a normal part of the conversation like lots of other topics are. So that, because a lot of this really isn't that complex. It's fairly simple from, you know, an experiential point of view. But nobody knows about it, nobody talks about it. So that would be my suggestion, to get it out there and don't focus on just the low income or anything like that. Everybody has the same level of ignorance of these topics.
And do you have ideas about, other than dreaming up that we have 17 Ed Youngs to write more books about this, like good ways to go about this? Is it personal contact with people? Is it newspaper stories? Is it, you know, what are the paths towards doing that in sort of the most useful way?
Well, I think there's a number of ways. You or someone brought up a game the other day. If we could get that into it. I mean, one of my pet peeves about marketing is how the snake oil salesman, etc., they aren't constrained by the truth. Yeah. And they have some of the most effective ways of advertising and marketing and capturing and engaging the public. Okay? If we could learn from them on the techniques, but use that to promote the truth, then maybe we can kind of level the playing field with them. Because right now they've got the advantage. They can tell you whatever you want to hear so that you will move your money from your account into their bank account. And I think the truth and the science and the facts could learn some from the techniques. And the games is one way, and just more information out there. And you know, there's more stories about mold, especially with the disasters that are happening, but it's all from such a sensationalized point of view that the real message gets lost. It's all in terms of a disaster, and what you guys have been talking about in a study and is just normal, ordinary, everyday life, and what effect that has on people. And I'd like to see it go more in that direction than just the disaster.
Oh, this is a question, I guess.
You want to people introduce themselves first? So.
Okay, I'm Erica Hartman at Northwestern University, and I have a question that sort of stems from the idea of how much we're using citizen science, and also what Amy mentioned about everybody getting their own genome sequence, and basically there's a lot of very personal data that's gathered in a lot of these studies, looking at buildings and looking at individuals' homes or looking at businesses. And I was wondering if there are, or if anyone other than me, I guess, is thinking about privacy and security and how we can protect the people who are either participating in our studies or who are citizen scientists from being taken advantage of and losing control of their data. I'm sort of thinking of like, is there a Gila kind of situation that could arise out of our work? And if so, how can we preempt it and prevent it?
Yeah, that's a really good question. I mean, there are, I don't know if Rob Knight is still here. I saw him in the back a few minutes ago, but there are certainly people that have been thinking about this issue a lot with some of the microbiome projects. The closer they get to individuals, like the American Gut, the more people have been thinking about this, I think, and they certainly have done a lot in terms of thinking about privacy and what happens to the data and how you deal with it in a way where you can still do the research, but where people's privacy is not being violated and where they have full informed, you want informed consent, right? So there are people that are willing to share all their genome data or share all their medical records data or all their microbiome data, and they're okay with the risks that come with that. And there are other people who don't want to do that, and I think the critical part is to have informed consent about what the theoretical and known risks are associated with this. And that's true for building surveys with companies, that's true with building surveys for homes, that's true with phone survey. I mean, it's true with any type of object where there's some piece of information there that might connect back to an individual or a group of individuals. So I think there has been a lot of discussion of this in the microbiome community in the last couple of years. It hasn't reached the level that, say, human genomic data has yet. We've been in discussions of doing something that I actually proposed at the original human microbiome meetings, which I think we still need to think about, which is, I think we need microbiome counselors, like we have genetic counselors, and we need training of people who are not, more training of people who are not actually the scientists, but who are doing the LC, the ethical, legal, social implications of the work. And certainly some microbiome projects, some citizen science microbiome projects have been doing that. I think we need a bigger effort on it. And it needs to be thought about much more extensively probably than it has been. Does that sort of address?
To think about like the kind of thing where I guess there's this idea that we're getting our genome sequenced and eventually insurance companies could potentially charge you a higher premium or deny you insurance because you have a genetic predisposition to whatever. Could we potentially be putting people at risk of the same sort of treatment if an insurance company finds out that they have an allergen or something in their home or And how do we prevent that? So I think it would be great to have guidelines about, when you collect these data, make sure that you're not storing addresses with, the actual sequence data or something like that. The same way we protect and we have guidelines for patient data.
Yeah, so microbiome research, if it involves any individuals, has to go through IRB type of approvals, or should go through IRB type of approvals. Yeah.
So there is an extensive IRB that's already been in place. So the American Gut Project has expanded a couple of times with other collaborative projects, and they fall under the same IRB, but under the same restrictions. With this project, only the holding entity, so in this case, Rob Knight's group, has any identifiable information at all about them, and it's not given out when the metadata is put on GitHub or the papers are written. So it is conscientiously making sure we're protecting the people, even where they're from. so that we're careful about that. So you're right, it's very important to think about. Just one example, I know when they did the New York City subway system study, they pulled out all the human-related. They could tell where people who were riding on the trains were from the boroughs. Anything that was human-related, they pulled and never went into a database, public database, or into data analysis. So that is definitely being thought about.
Yeah, I mean, I just say that you need to do sort of full informed consent in these cases because there's always ways to get around the protections. So people have to be prepared for the potential that their privacy will be revealed. You just can tell them what those protections are and how you're trying to prevent that from happening.
The International Society of Environmental Epidemiology has a very extensive ethical position document. And if you go to iseepi.org, it's downloadable for free. They put a lot of time and effort into it, and it covers everything that's been mentioned here and more.
It's been a great panel discussion already. I want to interject a few comments that you can either choose to follow or ignore. I am looking around the room. I'm guessing that 75% of the people in the room are going to be writing grants for their research. Okay? And so I truly hope that they continue to stay in MoBE Research. Now, the Sloan Foundation is not going to be funding new research grants over the next 2 years, but we will have a whole series of grantees who have funding that lasts for the next 2 years. And I will be, I have limited funds to fund workshops, stakeholder engagement, and so on. So what I suggest you consider, should there be some sort of outreach that's focused on homes? Should there be some sort of focused outreach on hospital-acquired infections? Or put whatever category you want, but then I'm open to working with people on that.
Yeah, there are, if you pass the microphone back around, there are people who...
I think Mark has been saying.
Yeah, so we have Mark over here.
Let's see. As I understand it, the Sloan funding was to develop the microbiome, endomicrobiome research as a pure science, but now it needs to get handed off to link to more practical areas to attract future support. So I liked Rachel's idea of trying to learn how to do early diagnosis of buildings before they fail. And so a couple of thoughts about that. First of all, it's a very good public health concept that they call primary prevention, which is when you learn to prevent disease before it happens at all, which is even better than learning to identify the problems in a building that exist and fixing them. It also would be useful if you could diagnose buildings that are going to fail structurally, regardless of the health of the people. And I think to do any of that, the microbiome methods, the sequencing methods need to improve, because to do research with them better, they need to be more comprehensive, less biased, and more quantitative. And until you can accomplish that, there'll be limits in how you can link them to anything useful.
So
I'd also add that the viability aspect would be nice too.
The which aspect?
The viability.
Yeah, oh, yeah.
So following up on what Paula said, do you think there would be value in the next year or two in a targeted workshop to discuss this topic and plan some sort of...
Is Rich Shaughnessy here? And Jordan,
he's
here,
left.
you organize. They're organizing something.
There's a targeted workshop, mostly focusing on mold in buildings.
And do you...
It has at least 50% of the participation, at least so far expected, is going to be from inspectors, practitioners.
And out of, I don't know if you were thinking this too, but out of maybe curiosity more than anything else, are you imagining in this, like, who would fund long-term research in that area? Like, what are the potential sources of that funding?
Good thing to talk about, yes. Yeah.
Is that what you said, ASHRAE, or?
Yeah, you're on a committee.
Let's call him out.
Well, ASHRAE, HUD, maybe EPA will get new funding? Who knows?
I mean, are there again, going back to the question I asked before, which is, are there sort of these practical applied areas in addition to these that it would be worth trying to gather together a group of people to think about how to apply for funding in other topical areas? What are those?
Well, I mean, one of the, so some of the most compelling data I've seen are ones that incorporate some illness, so immunological studies with something personal, so either genetic or personal microbiome, and environmental exposures. So thinking how all those three parts fit together. And it seems like it's more often to study the two, so personal genome and immunology, and not include the environmental aspect of that triangle. And so I see a value in trying to insert ourselves in ongoing work.
I was to say, in some ways, some of the most compelling work from the microbiome and the work that maybe will go on in the future is adding new tools to pre-existing or older problems, and that's fine. But it seems to me like, in the main, after the Sloan program, it's going to go back to the way it was before the Sloan program, which is selected problems that are still out there. And what this community misses that other communities have is a division at NSF, or somebody who, or some commitment that is explicitly committed to funding building problems. And I think for something like a workshop, and I don't know the right way to say it or to put it together, but maybe other people do, is there's this sad dichotomy in the work that we do. One is that we all live in, except for, a friend I had in college who lived in a teepee, the rest of us, we live in a house or something. We live inside buildings. We all spend our time in buildings, and our environmental exposures are most certainly in buildings. Our health is wrapped up in those exposures as well. But we don't regulate buildings, and regulation is the magic to get government intervention and funding in environmental areas. And so how does this community move forward in the absence of a regulatory driver? I don't know that, I was interested in what Carl said about facts versus feelings. I don't know that facts are going to make the case. It might be feelings, but I'm okay with that. I mean, for driving the research funding, it's got to be facts when you do the research.
No.
Hi, my name is Jean-Pierre. I'm from Michigan State University. Thank you for a great conference. It was my first time to attend the conference because I happened to be the fellow for this year. But my question is, how do we attract industry to what we are doing? Because, it's great we are studying a building. There are people who live in a building. There are someone who supplies the material used to build it. So if we can study what is happening with the mold, but the guy who manufactures all of the material we use for construction is not present when we discuss things that are going on, how they may affect the design, how ventilation is an issue, and the guy who makes all of the ventilation systems is not here. People who manufactures heating systems, either the ones that uses gas, that may propagate heat from the bottom up, or the ones who make electrical. We have not yet succeeded to attract all of those people to be with us when we do these discussions. I think we're still missing something big. And probably they may also be interested in providing funding for some of the different questions we may be interested in responding. So I think that's something we may need to think about. Thanks.
I mean, one way to drive that is to create consumer demand. So, it seems like a lot of the resistance to taking antimicrobial products out of soap, right, was because of consumers were willing to pay for it to not be there. So there's a role for scientifically informing the citizens to sort of request that from industry.
I was going to say, I like the bit about consumer demand. I think that's a really important component. It strikes me as in the 1950s, when we looked around at our water and our air, there were big problems, especially in water, and a lot of it had to do with wastewater discharges. And so we came up with the Clean Air Act in the 1970s, and we built all these wastewater treatment plants. It turns out the wastewater treatment plants didn't work very well. And so in the 1980s, there was this bloom of research on how to run a wastewater treatment plant. The people who got together and funded that, in addition to the government, were consortiums of wastewater treatment plants. They got together, they formed something called WEFTEC and WERF, which stands for the Water Environment Research Foundation, and they funded specific problems to make sure wastewater treatment plants can operate properly. I wonder if there's an analog in this area. Is it builders? Is it homeowners?
That's Peter Ashley with HUD. That's my point. We live in a very litigious society. You all probably noticed that. But sometimes there's a good side to that. You know, it makes products safer. And as we understand the cause and effect a little better with the indoor microbiome, some high visibility lawsuits might help drive safer buildings and homes.
Yeah, I mean, I don't know if Kevin is out here. I mean, there are efforts to try and, you know, engage various working groups from industry to thinking about what they can do in the microbiology, the built environment space. And we have examples. There are people here, Jessica and other people who have started companies in this space. And I'm wondering, I don't know if any of them want to comment on like what crosses the threshold, what gets people, you know, engaged in that, and how we can identify gaps in those areas. And maybe going back to Paula's question, is there research that needs to be done in order to convince people to go into this space first, or are there, you know, applied projects that could be done to convince people to go into this space in some way?
Well, I think health is such a huge driver. I mean, if we're thinking about what the people care about, you know, they care about not getting sick. And there's still some key interdisciplinary questions there. I think we've identified some very compelling associations between the built environment microbiome and all sorts of diseases. But my fear is there's still work to be done to take that step, that further step. What is a healthy microbiome? And with it being in that interdisciplinary space, it can fall through the cracks. And so if we're going to host a workshop or try to invest a little bit more in the science, I think just taking a few more concrete steps towards linking the built environment microbiome and human health and this whole concept of what is a healthy microbiome.
Just follow, it almost follows right from this point, but several of the points, but having actual actionable, you know, going from seeing these, these compelling signals to having sort of actionable public health information, and then being able to really evaluate and design interventions on top of the fact that over and over and over again, people pointed out the massive complexity and unintended consequences and things. I think one possibility is some kind of effort around doing more modeling, and which I don't even think, I think you're bringing together yet another sort of range of disciplines, because it's not going to be just straightforward mechanistic modeling. I mean, there's going to be agent-based modeling. There's a whole set of different types of modeling tools that you would have to bring to bear on this problem to be able to sort of bring as much of this information that you have generated together and start testing some interventions. And I think including, people from DOD, if you're also then wanting to generate case examples where you could then test the model, do some modeling, go in and test some interventions, having some other kinds of organizations like DOD where there's some good case examples which may not be specific to the residential environment but actually intersect really nicely to demonstrate points, might be a possible step or one next step.
Yeah, Jonathan and I were just
Yeah.
talking about that this morning, that's something that could be strengthened in this group is the modeling and that, you know, some of the traditional risk models like dose response really are too simplified, that we need something that tackles the complexity and things like emerging diseases, antibiotic resistance. Yeah.
I just want to jump in really quickly with Jonathan's open door there. This is Kevin with the University of Oregon. I think we've been wrestling for the last 2 years, my entire time at U of O, about how to find a way to progress this work with seeing the end of Sloan funding coming and with an eye toward industry. And we're trying to bring to bear some of the lessons that we learned from another market transformation effort in energy in buildings. And as a short aside, I think it's really interesting how many of the best sustainability experts are kind of in this energy space because there was a funding source there, right? So now there's a lot of attention moving toward healthy buildings, and it's less clear about what that funding source is going to be in healthy buildings, but there's a lot of public interest, so I agree with the sentiments that Amy brought up. And now it's odd when you go to healthy buildings convenings, you look around the table and you see a lot of people who spent 10 or 15 years or longer working on energy efficiency, and not enough microbiologists or chemists or medical doctors. And so I think there's a lot to be said about a convening effort. And in terms of transitioning to industry funding, I think we all have to get a little more comfortable with the implications of doing industry-funded work. The source of the funding colors the perception of the results, and in some cases colors the design process, right? But we have to find a way to continue to bring funding to do this work, and it may be with industry. So, you know, having a high level of self and peer regulation about standards on scientific inquiry, while also having some flexibility in looking at funded research that had industry support behind it. And I think that's a two-way street, and we have to not look down upon industry-funded work.
Wendy Goodson, AFRL. I just wanted to hit on the DoD comment. I think there are a lot of opportunities in the DoD for increasing funding level in this area in particular. Currently, DoD funding on microbiome research is really restricted to things like gut microbiome, skin microbiome, hardly anything. Really, my lab is the only lab looking at the built environment, but there are tremendous opportunities there. I don't know if you guys saw the poster that was out there about moldy tents. There's a study, a corrosion study going on right now, funded by OSD, looking at degradation of those tent materials, but nobody's looking at the health aspect of exposure to those kinds of environments. Similarly, when you have people captive on a submarine or on a ship for a long period of time, they're going to get exposed to those things, and so nobody's thinking about that, and they're thinking about microbiomes of folks and how they change as a result of circadian rhythms on submarines. I know that's being funded right now, but again, nothing about the microbiome of the space. And the last point there is you've got a group of individuals whose health is tracked long term, and there's already, as we were talking about, policy issues about keeping their information private. There are already issues around that. They've thought about how to do that for the DoD, so there are opportunities there. If you guys are hosting a workshop, I'd highly encourage you to invite some of those program managers from DoD, ONR, ARO, AFOSR.
And just following up on that, do you have any recommendations for like what type of information is most useful in order to then convince some of these different DoD groups that this is worth funding?
I agree with thinking about things like allergens or VOCs within the environment that could affect these people's performance. Any data that can be wrestled up on that kind of thing would be great. I know that when we encounter mold on aircraft, there are literally no specifications for aircraft about what those exposure levels should be because nobody's done the studies there, and I'm certain nobody's done it on submarines or or tent communities or
Well, I don't think
anything.
those exist for any environment.
Okay, well, there you go.
Sorry, I think we had one.
Bill Bonfleth from Penn State. I've been accumulating a lot of ideas here. I'm not sure I can remember all of them. I mean, as an academic myself, I can't believe there's anyone here who works at a university where there isn't an office full of people who are beating their door down to have them give them information that they can broadcast through their web pages and newsletters to tell the world how useful their institution is to the state and to the country. Do it. You know, my last piece of research was on control of biofilms on cooling coils with UV, and the university put out a news release on it, and I started getting calls immediately about it. I still am after a month, so that's an easy one. What to target in facilities? I'm an architectural engineer, so I'm more concerned with design and operation of buildings, not so much with what the occupants do, which is a different branch. I mean, I think there's some things that in the microbiome that would be addressed by changing the behavior of occupants. What do they bring into the house? What do they do as far as cleaning procedures? I'm more interested in what do we make it out of, and what design criteria do we design to. So you have to find problems where information that you can get with these tools that you have will actually be useful to the people who develop design guidance. What does an engineer need to know about mold today? Keep your building dry, right? So the architect has to design the envelope to reject moisture and to dry out gracefully. The mechanical engineer has to design an HVAC system that controls the humidity reliably. We have to try to avoid condensation. None of those things really require any advanced knowledge about the microbiome, but maybe materials do. So I think building materials and building materials that will respond well to having been wetted is a very important area that some organizations would be interested in working on, but not others. For me, as someone whose field is environmental control, what I need are criteria that I can design systems to. So until you can tell me what needs to be measured and to what level I need to control it, I don't have a problem that I can solve as an engineer developing a system. It's very simple. And to go to the issue of why is energy getting a lot more attention, or did it get attention earlier than healthy buildings? You can measure energy, you can monetize it. I think I've said this before in some of the MoBE meetings, that we really do not have an equivalent ability to say what the value is of indoor environmental quality, and we don't have the ability to monetize a specific risk factor. So we know that people get sick at home, they get sick at the office. What causes that? Did I get sick because of something in my home? Did I get sick because of something in my office? Did I get sick because I sat next to the wrong person on the bus? Was it airborne transfer? Was it fomite transfer? Was it something I ingested? We have to try to come up with at least a reasonably credible way of characterizing risk so we can try to reduce it with various interventions. So that's what I would work on. And from that point of view, to go back to one other thing, I think that healthcare is the space program for indoor air quality. Right? Think of all the things that we have, the wonderful products that we have that came out of the space program just because we were trying to put people in outer space. Space food sticks, for example. There are a lot of, but many other products. I'm being facetious there. I think that healthcare is the perfect place to go because that's the place where the microbiome is probably the best characterized and where the consequences of it are best characterized and monetized. If we start doing things that work there, then maybe that will generate enough interest to put money behind figuring out what happens in the buildings that people live and work in every day. So I think there's probably a chain of events here that we could set in motion by picking the best target. And these things about tailoring the microbiome, eventually, that's aspirational, it's wonderful. But what people would really react to now, I think, is reduced infectious disease incidence and reduced incidence of allergies and asthma. So that's exactly where I would put my effort because that's where the money is going to come from the most easily.
Can I just follow up with the healthcare? Do you mean broadly all healthcare, or are you talking specifically like things in hospitals? Because
yeah, I'm thinking hospitals where you have facilities where their bottom line is, and their reputation depends on the outcomes of the patients.
There's someone behind you, right behind you.
Good afternoon. I'm Will Pratt from the United States Army 20th Engineer Brigade over at Fort Bragg. And in terms of projects going forward, I know that speaking from my perspective, as having been in the Corps of Engineers and also in the Operational Army, there's always projects out there. I know that, say, for us over at Fort Bragg, on our end of the installation, it's been neglected, and at some point they're going to start, as part of the Fort Bragg master plan, they're going to renovate an entire quarter of the installation, and that's going to be run by USACE, and that's being done all over the United States at these federal installations. So I'm very sure that the Corps of Engineers will be more than happy to maybe do some sort of partnership, if not through some sort of direct liaison, maybe through workshops with through the quality assurance, quality control program that they run on all these installations. And I'm very sure that, like for me as a former quality assurance representative for the Corps of Engineers, having more information as to the microbiome of the vertical projects that we were doing, whether it was in a cafeteria in Tracy, California, or whether it's going to be our company offices, which is where our company is about 100 or so folks, where we spend a lot of our time, whether it's taking classes, training, or storing our equipment, understanding the microbiome and how we can best improve that to improve our health, because those things are pretty nasty, especially on our end of the post. That would be greatly, greatly appreciated. So.
I'm Ji-Sun Yang from Biodesign Institute. I am Sloan Fellow with a joint NASA joint program. Please forgive me my English first. Considering the human, the health issue, I think we should consider about the human surrogate model, because I understand this MoBE field involves a lot of mega data collection and mega data analysis. From now, to translate those information to like a building engineering field and also health issue, we need to find some kind of solution. So to have and also to find the way to find the early diagnosis way before the building failure, or we have to have some kind of experimental tool to show, to confirm the statistical data. So I think that considering that, and also also the industry, the healthcare industry also, before they, what should I say? Yeah, for healthcare issue, we a lot of cases we do we use the infection model, like an animal model, and or the cell culture model. However, considering those MoBE field, I feel that the mucosal immunity seems to be very, very important. But the human anatomy and then animal anatomy is very different, and there is a very limited study model to induce mucosal immunity, which is similar to human. So, these days, a lot of people people try to develop different kinds of human surrogate model, including organoid model and a 3D cell culture model. I have some background with a 3D cell culture model, and currently I am doing some, I'm trying to profile mucin layers. So because considering the characteristics of mucosal immunity, inducing mucosal immunity is very, very difficult. I think it's also very important to find a meaningful human surrogate model to study the mucosal immunity for this MoBE field for probably next conference.
So do you think, I mean, there's another challenge in this, which is what is the building side of that model, right? I mean, so it's not just having the right animal model to use, but it's also what is the built environment that you set that up in, which is a little different than sort of the people just studying the immunology side of these stories. I mean, have you thought about like that side of this issue, or?
I'm sorry, would you say again?
Just well, so in general, if we've talked about this before at MoBE meetings, like the utility of having model systems for addressing some of these questions. It's really complicated in studies of microbiome of the built environment because you have to not only have sort of the human or animal model for the impacts, but you also have to have agreement on what the actual physical infrastructure, the building, the built environment that you're using for that model is. So that's what I was asking, if you thought about that side of things.
So this MoBE field, what I understand, I'm really early career in this field, so I don't know a lot about it. So what I understand is this MoBE field, there's two different issues. One is building integrity, and the second is the public health. So the material-wise, of course, the infection model, like an animal model or the tissue infection model, has a little distance to the material. However, when company or whatever the material, when people produce any kind of material, we need to test something before. So, for instance, when we have some kind of like a metal material or whatever plastic material, before we actually distribute, we don't know how the microbiome home microbiome that we already studied would impact for that material, and then that would and then not only the physics side, after degrading something, whatever the debris or the microbial metabolites could impact for the human health. So even I think that this whole considering that this human surrogate model, like infection model or mucosal immunity model, could be really helpful. Not only the hospital or the military field, but also the building material company side as well, before they actually manufacture something, or the architecture find the right material in order to avoid adherence of microbiomes adherence. If we have some kind of solid data or trustworthy data showing that this material would be safe for, even though one, maybe this material may not have a lot of corrosion or biofilm information, and even though it does, because a lot of cases it is a kind of inevitable. Whatever the debris may not be very toxic, it may not produce a lot of toxic material impact for human health, inducing whatever allergy reaction or the asthma reaction. So I think even material side, also it may be really helpful. I don't know if this is a right answer or not.
So I think I have a little bit of, my question or comment is a little bit related to that, in that it sounds like from what I've been listening to, that in a lot of areas it would be very useful to have effective tools that are efficient, rapid, small scale, that can monitor the microbial populations over time, potentially also metabolites. That may be something to look at in terms of a workshop, at least to identify the different groups that would be interested in having those things and try to develop a plan to figure out what could be monitored. certainly one of the most obvious places where small, lightweight, efficient, not particularly many disposables, tools of that sort for monitoring space flights, an obvious use for that is, I think, also military and other areas. Some sort of better technologies for being able to monitor effectively over time, repeatedly, in a consistent fashion would also provide some inputs to using how you test the models. But it would be very useful to like
So I was struck by something David Mills said in his talk related to this, which was that there were these students who were developing these amazing, small, portable, cheap sensors, not for the microbiome side of things, but for the physical environment side of things, which is also, of course, important, and that he couldn't convince any of them to develop them further because they were all getting hired away to Google or some other place. So I'm wondering how, what are those sort of technological issues that would be great to have developments in? And in addition, how do we keep the people developing them from going on to do other things?
Well, we just need to convince Google to get interested in doing it.
Yeah, okay.
So at least for spaceflight, the kind of work that has been funded looking at some of the related areas to what I do, it's relatively straightforward to develop sensors that measure a relatively small number of items, but trying to put something like a microarray, bathymetric style microarray chip readout on station becomes more complicated the more multiplexed things get. And it's the multiplexing that's really going to gain a lot of background. I mean, minions are fine on space station, but they only sequence one piece of DNA or RNA at a time. So how do you do that in a very, very multiplex fashion? I think would help with that kind of sensor capability.
Okay.
So I've actually got more of a question than a comment. So the bulk of the work I've seen at this conference and throughout the MoBE field is bacteria and fungi. My question is first, what about viruses? How important are they in the built environment microbiome? And two, how can we start to study the viruses? Is there a strategy that we can take? Is it bring in new people? What are your thoughts?
Don't let Scott Kelly get the microphone. I mean, there are people who study the viruses in the built environment, and there are somewhat more of them than there were a few years ago. It's technically a little bit harder, or maybe a lot harder, depending on which groups of viruses you're looking at. So, I mean, I think it's critically important. I think if we go back to the origin of the MoBE sort of Sloan program and some of the meetings that we had then, a lot of us talked about how there were lessons we could learn from the other communities that had already been working more actively on sort of applying new technologies to studying microbial communities like the human microbiome or ocean microbial communities. And they went through this same evolution. A lot of work on the low-hanging fruit, which in many cases happened to be rapidly growing organisms like bacteria, and or ones that were cheap to generate sequence data for. And then they were like, oh, we got to move on to these fungi, and now the protists and the viruses. But when you do that, the story becomes much more complete and much more useful. Integrating the viral information in the human gut microbiome is becoming a really important area of research, same as fungi, same as protists. So it's a great question. I mean, I think that that's an area I can imagine a workshop in where it would be really useful to get people together to say, okay, we sort of, people are doing this, how can we get more people to include viruses? What technology do we need to make it more efficient and cheap and so on? I think the same is probably true for fungi a little bit, and certainly as Jane Carlton, I mean, like the protists and the other eukaryotes, so there's a lot of gaps still. Okay, I think we're supposed to wrap up now. I'm getting the, yeah, all right, the wrap-up sign is we're done. And thanks for the discussion, and I think now we're going to have Paula give a brief closing summary. Brief remarks, I'm sorry.